You guys hear me okay in the back? Okay, terrific. Well, thanks for coming. And how many of you came to my presentation yesterday? Oh, wow, a lot of you. Okay, well, we're continuing with that same, on the same thread. Yesterday we focused on cancer, and today we're going on to reversing disease, because the underlying principle of what you're learning from me is that the same diet style that maximizes human longevity and slows the aging process, enabling us to live well with our full physical and mental faculties to 100 years old in good health. Those same principles work therapeutically to reverse disease and effectively enable people suffering with autoimmune conditions, early stage cancers. We talked about those cancer cases yesterday. Heart disease, diabetes, strokes, heart failure. Lots of people can use this therapeutically to reverse disease much more effectively than taking medications or conventional medical care that's focused on surgery and drugs. That's what this is all about. Giving people hope and the informed consent they need to make the right choices for their life, to protect their precious health, because you only get one body, and when you destroy it, you don't get a new one. You just get one. And a nutritarian diet is all about picking the finest foods to put in your body, the foods with the most documented protective effects to slow aging, prevent cancer, and protect your health, while at the same time minimizing or eliminating harmful foods. Kind of simple, isn't it? What could be more simple than that? We are what we eat. You can't expect to eat bagels and pasta and donuts and cookies and crackers and rice cakes and breakfast bars, whether vegan or not, and expect to have good health. You pay a price for every food you put in your body that's low in nutrients. Because when you eat foods that are low in nutrients, your body builds up more toxic waste products. And the waste products we're talking about here, there are many of them. We talk about reactive oxygen species of free radicals, and we talk about advanced glycation end products, and other toxins that build up and make us into food addicts and calorie-consuming monsters. And the more you eat foods without nutrients in them, the more you are desirous of extra calories. And the secret to achieving an ideal weight is meeting your nutritional needs with healthy foods so you don't become a food addict and don't desire excess calories. So with that as an introduction, let's get started, because I feel so rewarded and blessed to be able to have affected the lives of so many thousands of people. And the real superheroes here are the people that have made those changes in their lives and recovered their health. And it's exciting for me to see these people who've made these changes and recovered their health, and I'm excited to present them to you. So in this presentation, I'm going to present some cases to you of people who've made changes in their diet and recovered their health, to see the examples of the power of nutritional excellence. And these people are representative of what a nutritarian diet can do. That's what we're doing here today. So the American diet, or the standard American diet, the SAD diet, some people call it the SAD diet. I call it the deadly American diet, designed by ISIS, maybe. Because if you eat American food, it doesn't just cause cancer and heart disease, it also makes you dumber, it lowers your creativity, it increases risk of mental illness and depression, and it destroys your life, and you get wrapped up with medical tragedies, so you can't enjoy your life as you get older. It's destructive, and it's actually disgusting. And to simplify this, I'm grouping animal products and processed foods together in one category. I'm saying here, let's make it quite simple. There are three types of foods. There's natural plant foods, and then there's processed foods and animal products. And processed foods and animal products have a lot in common, right? I'm always saying a bagel is like a piece of chicken. A bagel is like a piece of chicken because neither one contains a significant micronutrient load. They don't contain a substantial amount of vitamins and minerals. They don't contain fiber. They don't contain antioxidants and phytochemicals. And we're eating calories with no significant nutrient load. And the more we eat empty calories, the more we shorten our lives. Everything you put in your mouth matters, and when you put in your body colorful plants, then you're flooding your body with powerful nutrients, particularly antioxidants, phytochemicals, and those nutrients that protect our telomeres from aging and stabilize our stem cells. What I'm saying right now is that the RDI for vitamin C might be 60 milligrams, but a nutritarian diet might give us 600 milligrams. The RDI for vitamin K might be 150 micrograms, but the nutritarian diet might give us 10 times that. If we follow animals around in the jungles, like baboons and chimpanzees and gorillas, with telephoto lenses and measure what they eat, we find they consume 20 to 50 times as much antioxidants and nutrients as people eating a standard American diet. Way above the RDIs for these phytochemicals and antioxidants. Are those nutrients wasted? Are we just urinating them out? Did nature err and give us too many nutrients in natural foods? Of course not. The body, in other words, the nutrients we need to stay alive are not the same nutrient levels we need to stabilize our stem cells, to slow the aging process, and to protect our telomeres so we live a long time in great health in our later years. In other words, it's called the triage effect. The triage effect means if a person comes to the emergency room in acute need, we take the people who are urgent need of dying and take care of those first. We don't give our attention to people that are more stable. That's what the body does. When you're getting a marginal amount of nutrients, not enough, it utilizes those nutrients for its immediate urgent needs to keep you alive, surviving, and reproducing the species. But it's not going to be taking in enough nutrients to utilize to stabilize your stem cells, to stabilize your telomeres, to protect your immune system for maximum function, and to have you age slower. It's going to use what it needs for its urgent needs. That's where the nutritarian diet is different. It's not about only meeting our immediate needs. It's about nutritional excellence, so we're able to push the envelope of human longevity and still maintain adequate immune function and cellular function and repair function as we approach 100 years old in later life. So we're talking here that a bagel's like a piece of chicken because they don't contain those beneficial nutrients. But there's another reason the bagel's like a piece of chicken. They're also foods that are hormonally unfavorable because the high glycemic bagel drives insulin too high, and that's a growth-promoting fat storage hormone. And the chicken drives IGF-1 too high. And that's also a growth-promoting, fat-promoting hormone. And when we're grown, we're fully grown, mixing these hormonal effects where you have extra estrogen from being extra body weight. Having extra body weight promotes extra estrogen because fat cells promote aromatase, the activity of aromatase. Fat cells make you insulin resistant, causing diabetes. They promote angiogenesis, and they make the effects of IGF-1 on cancer worse. What I'm saying right now is the bagel exacerbates the harm from the chicken, and the chicken exacerbates the harm from the bagel. If we really want to kill people and create cancer, this is what we do. Give them a diet that contains these high glycemic carbohydrates and give them a lot of animal protein at the same time. The American diet right in front of you, the standard American diet, where people are eating 2% of their calories from vegetables. The most powerful anti-cancer food in the world, longevity-affecting food, are vegetables, and the American diet only eats American people only eat 2% of vegetables in their diet. If we plot the amount of unrefined plant food, this is all about eating more unrefined plant food. And if we look at data from the 1960s, we can go back and see countries that ate a lot of unrefined plant foods. And if we look at those countries that ate the most unrefined plant foods, we can see as those foods increased in the diet, those diseases of nutritional stupidity, like heart attacks and cancers and strokes, go down to nothing. It's a direct inverse correlation. More unrefined plants, less disease. Quite simple to remember. This is irrefutable. The amount of scientific evidence that from the scientific literature and from historical evidence and also from epidemiologic studies with large numbers of people going on for decades, we find that, of course, that we know that fruits and vegetables and beans and nuts and seeds extend lifespan and are good for us. And you take any one of those foods out of the diet, you remove nuts and seeds from the diet, people don't live as long. You take beans out, they don't live as long. You take fruit out, they don't live as long. You take, in other words, as you remove, we know that vegetables are the most powerful foods against cancer, but we also know that a diet that includes vegetables and fruit has better effects at protecting against cancer than just the vegetables alone. It's the synergy of all these foods together, having a wide variety of plants. And right now we have an unprecedented opportunity in human history to be able to have a wide variety of clean, organic plant foods in our diet that we never could achieve in human history. What I'm saying right now, the portfolio of foods available in a nutritarian diet are much broader and more protective than what's available and was available in the blue zones. The blue zones are not representative of the healthiest diets available. They're just lucky to have a better diet than the average American diet based on what's locally available to them. They're not based on science. They're based on what's locally available and customs and the way people have eaten for a long time. And they're much better than the way Americans eat. And they afford people the opportunity to live approximately 10 years longer than the average American. But a nutritarian diet doesn't attempt to replicate that. This is much better than a blue zone. We're taking the best of all the blue zones, using science to design a dietary portfolio that maximizes human longevity and blows out the results of a blue zone out of the water and have people live to be 95 to 105. Not just 8 years longer, but 20 years longer. There's no controversies here. It's essentially right now well established with a huge amount of science that excessive amounts of animal products, as animal products go up in a diet, so does disease risk from the common causes of death. And as refined carbohydrates go up, the high glycemic carbohydrates, so does the same causes of death. And we can argue which is more dangerous, but it's an irrelevant point because they're both dangerous. And even moderate amounts of white rice and honey and maple syrup and white bread, even moderate amounts increase disease. Even 2 servings a week of commercial baked goods are associated with increased risk, 50% increased risk of depression. Even 1 serving a week of French fries is associated with a 26% increased risk of later life breast cancer. Even moderate amount of these foods. So people advocating this plant-based whole food movement, but suggesting that we should just do it partially, it's not really giving people what they need to know. Because if you really want protection, especially because many of us haven't eaten healthy the first half of our lives, you can't just do this moderately. You have to do it all the way, because then the magic happens. And that's what this lecture is about. It's about doing it all the way and seeing the magic that happens. First of all, heart attacks are a recent phenomenon in human history. Just like yesterday you learned cancers didn't occur years ago, well, heart attacks didn't occur many years ago either. This slide was cut and pasted from the American Heart Association's website, showing that only 4% of the American population had heart disease around 100 years ago, whereas now it's about 40% of people die of heart attacks and strokes and other cardiovascular diseases, and about 70% of people over the age of 70 die of heart disease. It's very easy to prevent heart disease. And the health equation, the first principle of a nutritarian diet, says to you, eat healthy foods, right? That's all this says. It means eat foods that have a high micronutrient bang per caloric buck. Pick your foods wisely. Pick the healthiest foods on the dietary landscape and eat more of them. That's what H equals N over C means. It means your healthy life expectancy is proportional to the micronutrient per calorie density of your diet, which means eat foods that give you a broad spectrum of micronutrients and phytochemicals for every calorie consumed. And when you do so, it adjusts your appestat and makes you no longer desirous of excessive calories, and puts you in touch instinctually with the right amount of calories you need so you no longer have to overeat to feel okay. Now you can comfortably eat the right amount of calories. What I'm saying right now is that the moderate caloric reduction that we're able to achieve when we ratchet up the dietary excellence extends human lifespan and slows the aging process. High nutrient, lower caloric exposure suppresses genetic alterations. Even genetic defects that could have led to cancer are suppressed by high nutrient, lower caloric exposure, right? We're talking about all the factors that make us age slower, like lowering the metabolic rate. What I'm saying right now is the metabolic rate is the rate at which I'm aging. Now, if I eat more calories, let's say I eat an extra 100 calories a day. Well, that'll add up to about 10 pounds of weight in me over a year, because 3,500 calories a pound, about 350 days in the year, extra 100 calories a day is about 10 extra pounds. So if I ate about an extra 100 calories a day, in a year from now, I'd weigh 10 calories more, right? Right? Wrong. Because what the body does is as you eat extra calories, it speeds up its metabolism to try to burn some of those calories off. So I may only burn 5 extra pounds, not 10, because my thyroid, my body temperature will increase, my respiratory quotient will increase to burn those calories off, my thyroid will increase its function, my body will put into motion a series of biological efforts to try to burn off those extra calories, speeding up my metabolic rate. But that's speeding up the aging process. What I'm teaching you right now is when your body accelerates its metabolism to burn extra calories, it's aging your body faster. You following that? We're not looking to speed up a metabolic rate. We're looking to slow down a metabolic rate. Here I am at 150 pounds, and my caloric needs for the day, let's just say, are 1,500 calories a day. Now what if I only eat 1,400, 100 calories less? Now 100 calories times 350 days a year, 3,500 calories a pound, that means a year from now I'm going to lose 10 pounds, right? No, right, wrong. Because I'm already at low body fat. My body fat's below 10%. The exercise I do gives a signal to my body that says, maintain this degree of activity because he's utilizing those muscles. Let him have that muscle tissue because he needs them, he's utilizing them. Don't let them go away. So my body's going to fight to maintain this weight and not lose the extra weight, not lose weight needlessly. So what do you think my body's going to do to try to not lose weight as I cut back on calories? What is it going to do? It'll slow down the metabolic rate. It'll lower the body temperature. It'll lower my respiratory quotient. It'll lower the thyroid function a little bit. It'll put into motion a series of parameters which will have me only lose a few pounds, and I'll have aged slower. You're learning the secret to living to be 100 years old, to age slower. It's completely different from the comic book nutrition you hear out there in the women's magazines or something, or the other, right? People are trying to look for a gimmick or a trick so they can speed up the metabolic rate so they can eat more food and not get too fat, right? Isn't what people are trying to do? And I'm telling you, you want to eat right and be able to eat right so you're comfortable eating a little less food so you can eat less and not get too thin. Following this now? Completely different. And you know what? You don't desire more food because you're satisfied with less too. Now, we're also focusing on foods with We're focusing on foods with a lot of scientific data to show those foods extend human lifespan. And I utilize this acronym GBOMS: greens and beans and onions and mushrooms and berries and seeds, so people can remember and have at the tip of their tongue those foods I want them to try to eat every day. Because when you put together a full dietary portfolio that includes raw greens and raw onion family with cooked mushrooms and cooked beans, that combination of nutrients is more powerful than just one nutrient alone, and it has the effect to make for the most favorable microbiome that thickens the biofilm and makes that biofilm adhere to the villi, lowering the glycemic effect of everything you eat. There's a huge amount of beneficial effects when you have the full category of GBOMs in your diet on a regular basis. Scientists call it the second meal effect. What they mean by that is the next day when you have maybe some oatmeal and mango and or raisins or in the morning, the glycemic effect of that breakfast is moderated and lowered because you ate the greens and the beans and the mushrooms the day before, and the microbiome is so favorable that it has the effect to slow the absorption of glucose through the digestive tract wall, lowering the insulin response. Even though you didn't eat beans or anything favorable at that meal, you got the benefit from what you ate at prior meals. That's why they call it the second meal effect. We can throw a dart at any of these foods and describe its amazing power to slow aging and to prevent disease, which we did yesterday, but today we're going on to showing this portfolio in action. Because when people eat this dietary portfolio of all these foods, they have an effect to reverse disease. For example, with regard to cholesterol lowering, this was studied by David Jenkins in Toronto, did a study on the nutritarian diet with a full portfolio of these foods, including beans and nuts and seeds and greens in the diet, and he found in 6 weeks' time, the LDL cholesterol dropped 33% in just 6 weeks. And you know what I see and what we find here? It's much more impressive than dropping cholesterol 33%, because this high antioxidant diet almost wipes out oxidized LDL. It's oxidized LDL that's the bad actor that causes heart attacks and strokes. And the nutritarian diet doesn't just lower cholesterol, it sets into motion a complex series of events that prevents inflammation in the blood vessel and in the heart. It accelerates the removal of the most dangerous type of cholesterol out of the body, particularly the oxidized LDL. It's not like taking a statin drug. The nutritarian diet's also been shown to lower blood pressure more effectively than other diet styles. The next most blood pressure lowering diet was called the DASH diet. The DASH diet is held in favor by most of the medical profession, but the low sodium DASH diet was shown to lower systolic blood pressure by a record-breaking 11 points systolic, 11 points, which was great. That's like drugs do. But a nutritarian diet was shown within 6 months to lower systolic blood pressure by 26 points, more than double of the low-sodium DASH diet. And this 26-point lowering occurred while the doctors were taking them off their medications, not leaving them on the same dose. Even more impressive. A matter of fact, what I learned from this study, I knew what the findings would be, but what this study taught me was how dangerous it is to let doctors be in charge of your medications as you change your diet for the better. Because what happened is that most physicians did not take the people off the drugs fast enough, and their blood pressure dropped too low before the doctor lowered the medications. Did you follow that? You're at risk if you change your diet and get rid of your high blood pressure, and you stay on the blood pressure medications, and you drop your blood pressure low not to perfuse the kidney or to cause you to faint or smack your head on the sidewalk, or have some other problem to arise because of low blood pressure, then there's a problem with that. Doctors have to be more careful with knowing about nutrition and knowing how to remove medications appropriately so people do not quickly become over-medicated. And statin drugs to lower cholesterol cause people to gain weight and cause them to become diabetic. And they increase the risk of breast cancer. And they increase the risk of macular degeneration and dementia and other problems. And you know what? They cause muscle breakdown and liver problems. Let me explain this. They're still causing fatigue and damage to muscle tissue, even if there's no pain, no apparent symptoms, and nothing in the blood test to demonstrate any damage is occurring. In other words, there's still damage that occurs even when it's below the level of measurable perception. Did you follow that? Damage still occurs. And after years and years of use, that damage builds up little by little and even weakens the heart muscle and could put you at higher risk of having a heart attack or a cardiac arrhythmia from your heart attack or from your cardiac ischemia, could make your heart weaker, not stronger. These are not without risks, and they're not needed when people are not ever needed. It's very rare that they would ever be needed on people who are eating healthfully. Blood pressure medications are also not safe. I mentioned earlier that calcium channel blockers have been shown to double the risk of breast cancer after 10 years of use, but you know that the systolic blood pressure is the pressure pushed on the wall of the blood vessels when the heart squeezes and explodes the blood like a cannon to get to your head and your feet, right? Blood explodes that blood pressure, shoots it out under high pressure, and that's called the systolic blood pressure. Now, the diastolic blood pressure is when the distension of the peripheral blood vessels expand as a result of that high pressure cannon explosion, and the contraction of the blood vessels that have been distended back again to the inside is what helps propel the blood back to the heart and lungs again. You don't want it to stay in your feet or your brain. It has to get back. How does it get back? Well, it's getting back as diastolic recall. That's the second heart. So it goes boom, 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 boom. And the second boom is the blood coming back to the heart. And when does the coronary arteries fill the myocardium with oxygen and nutrients? During systole, when the heart squeezes and explodes, or during diastole, when the heart relaxes and the peripheral blood vessels are squeezing the blood back to the heart? When does the heart get filled with oxygen? What? During diastole. Do you understand that? When it's refilling, it's relaxing. And what do blood pressure medications do? And how do blood pressure medications increase the risk of atrial fibrillation, cardiac arrhythmias, and sudden cardiac death? How come blood pressure medications are so dangerous? Because they lower systolic blood pressure at the expense of pushing diastolic blood pressure too low. And the blood can't get back to the heart adequately. So blood pressure medications are the primary reason people develop atrial fibrillation. They get atrial fibrillation from doctors giving them medications to lower their blood pressure. Then they go to the doctor, and the doctor has to put them on blood-thinning medications for their atrial fibrillation. Then they get hemorrhagic strokes, gastrointestinal bleeds, some other problems with that. Or maybe they get just GI irritation and reflux, and then they give them proton pump inhibitors, which increase risk of heart attacks, and they develop, it causes increased risk of osteoporosis from the proton pump inhibitors and the blood thinners. So they've got to give a bisphosphonate for that, which then causes more gastrointestinal problems and more irritation than the. It's just one after another. One drug leads to another drug, and another person's on 10 different medications to counter the effects of the other medications. The first thing we learned in the first week of medical school was that all drugs are toxic. They don't work because they're nutritive. They work because they're poisonous. Just like natural herbal remedies have efficacy based on their toxicity, not based on their nutritive component. We want to live in a manner to avoid the need for pharmacologic substances and remedies. We want to live in a manner to avoid the need for medical care or any type of care. I don't go to doctors. I don't even go to myself. What I'm saying right now is lowering diastolic to dangerous levels increases heart attack risk. Reducing diastolic blood pressure to below 70 significantly increases the risk of irregular heartbeat and sudden cardiac death. And medicating your blood pressure below 60 has 3 times the heart attack rate in the elderly who aren't medicated down that low. The only way you can lower blood pressure, the systolic blood pressure, to a favorable range without pushing the diastolic low to an unfavorable range is through diet and exercise and salt avoidance, not through medication. And I'm also saying that a low-sodium diet has too much salt in it. A low-sodium diet is a high-sodium diet. Because we look at populations around the world, like there was a recent discovery of a population of a tribal group in the Amazon jungles who never salted their food. And the blood pressure of 90 over 60 or 100 over 70 was held constant through all ages, and the most elderly members of those populations had the same blood pressure as children and no history of heart disease or strokes in those populations or in their ancestry. The same as the Catawba Island study, where they didn't salt their food. There's no what's the word, controversy here either. We're not meant to be pouring salt all over our food. Of course, people are very defensive of their bad habits and their addictions, and looking for any kind of rational, irrational, illogical reasons why it's okay to eat themselves and to tell people it's okay not to eat healthfully. It's fine if you want to do that. But my niche and my purpose is to tell you what's optimal. If I don't tell you what's optimal, then you don't have the opportunity to do what's best for you. And you don't have to do what's best for you, but at least you should be informed with information that's going to give you the opportunity to reverse your diseases and get well and have great health. Because if I water it down to make it more acceptable, then it's not going to work for a lot of people, and you've been sold out if you really want to know the best to get well and to be healthy as you can. Did you follow that? Other people could choose to water it down to get the masses in, but that's really not my purpose. My purpose is to give people the information straight and let them make the decision of what they want to do. What I'm saying right now, too, is the cause of heart attacks are caused mostly by clots. So there's a normal artery, and the lumen is the opening in the middle where the blood flows. And then as you eat unhealthfully and put plaque and fat around your heart, it doesn't occlude or encroach on the lumen. The blood vessel starts to remodel outwardly. It makes so that it doesn't interfere with the blood flow when you start to put down young plaque and gain weight and eat unhealthily. Now, as you're putting down this young plaque and the blood vessel is expanding and growing outward, not occluding the lumen, most of that fat is soft fat. And it starts to put a thin calcification on the interior lining of the endothelium. You see where it says calcified fibrous cap? So it's a thin cap separating the lumen from that lipid core. That's what makes this so dangerous, because the calcified cap between the blood vessel lumen and the lipid core is so thin, and it could crack and expose the lipid to the interior wall of the blood vessels. And you know what happens when you expose the lumen in the bottom right picture there? If that blood vessel cracks and some of that fat gets exposed, that's going to signal the blood to throw a clot to form. The medical term for a clot is called a thrombus, and a traveling clot is called an embolus. And thrombi and emboli, plural or singular, are the major cause of both heart attacks and strokes. What I'm saying to you right now, it's the newly laid down plaque that's most vulnerable and most dangerous, not the old plaque, because the old plaque, called obstructive plaque, that's been there for years, calcifies over. The calcified cap gets thicker, separating the lipid core from the lumen. And as it encroaches on the lumen and restricts blood flow, it makes it safer, less likely to cause a heart attack, because those older plaques that are more calcified have been infiltrated with smooth muscle and scar tissue, and they're not likely to rupture, exposing the lipid component into the blood vessel, exciting a clot as much as the newly laid down plaque. And that's why that most heart attacks occur around Christmas time, around New Year's, when people come back from cruises and overeat, and when they gain weight, when they put on 5 pounds. In other words, you want to have a heart attack? Here's what you do. Go on a fad diet and lose 20 pounds, and then go back and put back 30. Because the rapid regain of weight, you can only put back subcutaneous fat so quickly. You'll put back visceral fat and cardiac fat as you put on weight that rapidly. Binge over the holidays. That's how you have a heart attack. Why am I telling you this anyway? What does this have to do with the point here? And what it has to do with it, I'm showing you that placing a stent in the obstructive areas of the heart are not going to have you protect your future from heart attacks and strokes, because the cardiologists, with their calcium scores and their cardiac catheterizations and angiograms or whatever they're doing, they only expose and identify the vessels that have old plaque. And they treat those vessels to make you feel better. But that doesn't make you live longer, because it's the other plaques that aren't visible, that didn't encroach on the lumen, that are the most dangerous. Are you following me now why I'm telling you this? I'm telling you so you know that once you go to a cardiologist and they want to put a stent in you, now they put a foreign body in your heart. And where the stent ends, you have a nidus of inflammation that can increase the risk of having a heart attack. And now they kind of put you on a blood thinning medication for the rest of your life. Having that intervention did not lower your risk of future cardiac death. It increased the risk of death. Because now you have increased risk of hemorrhagic stroke and gastrointestinal bleed, plus you have the increased risk of having the clot form in your heart. Now you have a foreign body in your heart. The only way to reduce that risk and remove that risk is by not going after conventional medical care, but doing aggressive nutritional care. That's not 100 times more effective. It's 1,000 times more effective. This is what people have to know. The reason I'm telling you this is because I think that if people knew the real dangers and futility of the conventional approach, many more millions of people would look at dietary therapy more seriously and be willing and be considering making this change, don't you think? Because vegetables have tremendous power to restore elasticity and endothelial function, and they do. And the amount of vegetable portions a day is a measurable parameter that determines your risk, your cardiovascular health. Greens melt away heart disease. They're the most effective exciter of the NRF2 transcription proteins that enable the body to create that endothelial slipperiness and removing plaque. The body has the ability, it has built-in mechanisms to remove plaque and prevent plaque adherence. But we have to fuel those mechanisms of reversal with a high exposure to green vegetables. And that's what the studies show, just like the study I showed you yesterday that showed that people who ate the most green vegetables and the highest quintile of green vegetable consumption had the longest lifespan. Did you remember that slide from yesterday? On 130,000 Asians, who the ones who ate the most greens lived the longest, right? And we see the same thing with nut studies, that as people eat more nuts and seeds, we see dropping of LDL cholesterol, dropping of the small, dense LDL particles, and removal of the most dangerous oxidized LDL. And nuts and seeds also have been shown to help restore vascular elasticity and enable the body to accelerate the removal of plaque. We have numerous studies, more than 20, represented by this 5, the Adventist Health Studies, the Ohio Women's Health Study, the Nurses' Health Study, the Physicians' Health Study, and all these studies show the same thing. They all show dramatic reduction in cardiovascular death with the regular inclusion of nuts and seeds in the diet, and they also show reduction in cancer and reduction in all-cause mortality. We talked about yesterday the reduction in cancer, not just from eating seeds, but also from eating nuts, that nuts actually lower cancer rates significantly. The Physicians' Health Study is a great example because in the Physicians' Health Study, the researchers took extreme effort to ascertain the cause of death in people not eating nuts and seeds compared to those who had nuts and seeds. And they found the cause of death predominantly in people not eating nuts and seeds were due to sudden cardiac death. The lack of nuts and seeds in the diet was associated with a 60% increased risk of sudden cardiac death, which meant death caused by a cardiac arrhythmia, ventricular fibrillation or ventricular tachycardia. They even did autopsies on the people that died to ascertain the cause of death, and they interviewed the family members to identify those people who died quickly on the spot after their first symptom, and we found a great association between the lack of nuts and seeds in the diet and rapid or sudden cardiac death. You following that? This has been investigated, and it showed that the lack of nuts and seeds and the lack of these beneficial fats in the diet can promote a pro-arrhythmic state of the heart. Where saturated fats are pro-arrhythmic, the deficiencies in polyunsaturated fatty acids can also be pro-arrhythmic as well. You don't often see that when a person is overweight, but as they start to become a more normal weight and they're not eating sufficient nuts and seeds or fat in the diet, you can start to develop increased propensity of the heart to go into irregular heartbeat. Did you follow that? No? Too bad. Just kidding. What I'm saying here, we don't have to get into all these mechanisms on the slide, but what we're saying here is that there's a dose-dependent relationship, and a low amount of nuts and seeds in the diet, or I could say a higher amount, is not just protective against sudden cardiac death, it's also protective against developing atrial fibrillation. It's also randomized controlled trials also show an increase in blood flow and diastolic function and elasticity. There are lots of reasons why nuts and seeds show beneficial effects on longevity besides their fact that they contain beneficial phytochemicals. They also increase the absorption of phytochemicals and antioxidants and lower reactive oxygen species in the blood because they facilitate the absorption of nutrients from other foods eaten as well. Here's, for example, a meta-analysis putting together multiple studies on cardiovascular mortalities over 350,000 individuals, encompassing more than 44,000 deaths, showing a 39% reduction in cardiovascular deaths in people eating nuts and seeds versus those not. Let me make this clear again. Vioxx, you know what Vioxx is? It's a non-steroidal anti-inflammatory drug that was taken off the market in 2004. They took it off the market. When they took it off the market, it was the #1 prescribed drug in America. People loved it because it didn't cause gastrointestinal bleed, and they were using it for their pain. Because in preliminary studies on hundreds and hundreds of people, it found that people liked it better and it was getting good results. It wasn't until it was launched into the atmosphere of millions of people using it that we found it caused 100,000 premature deaths from heart attacks that they had to take it off the market. They didn't find out it was dangerous until millions of people adopted it, and then they had to take it off the market. You following me? When we launch these diets to large numbers of people, we have the chance to see their effects that may not be easily seen when you have a small number of people, because their incidence isn't that high of these diseases. And when we launch diets low in nuts and seeds to large numbers of people, we always see the same outcome: higher risk of premature death. You following that? And don't think that you eat one diet to prevent cancer, like green vegetables prevent cancer. But once you get cancer, there's a different diet you eat. Now you don't eat green vegetables. No, it's not the way it works. The way it works is the same diet that prevents cancer is the same diet that's most effective to prevent recurrence and to increase longevity and to reverse cancer when you have it. The same diet that maximally prevents heart disease is the diet that most effectively reverses heart disease and protects you from having an irregular heartbeat or sudden cardiac death when you have heart disease. It's not one diet for preventing it, another diet when you have it. That's illogical and ridiculous. The Seventh-day Adventist Health Study 2 was particularly impressive because they divided nut and seed intake into 5 different quintiles, and they found that the risk of death from people in the lowest quintile of nut and seed consumption compared to the highest quintile was a 39% difference in cardiovascular mortality, which was huge. And this study was so important because it found that the same risk was present in all demographics: men, women, young, old, black, white, Asian, vegans, vegetarians, non-vegans. No matter what the demographic was, it showed the same basic negative effects from not eating nuts and seeds compared to those. And the lowest quintile was eating about a third of an ounce, about a third of an ounce of nuts and seeds a day, the lowest quintile. The highest quintiles were eating about 1.5 ounces a day or something like that. It wasn't huge amounts of nuts and seeds, but it showed that, wow, that's kind of amazing. The difference between like a third of an ounce to like 1 ounce and a third, just a 1 ounce difference a day, made such a huge difference in death. That's amazing data to put into our brains. You following this? We don't want to make decisions based on absence of information. Nuts versus olive oil in the Mediterranean diet. It's been studied. You know what they found? It's surprising to our imagination is that when they gave people olive oil to take home with them, they probably ate less butter and less other foods, and it lowered heart attack rates by about 10%. That's good. Olive oil lowers heart attack risk, but not anything like nuts do. When they gave those people nuts instead of olive oil, it dropped heart attack rates by 60%. We don't buy a car by comparing it to a junkyard wreck. And just because oil is better than butter doesn't make it good for us. We can make anything look good by what we compare it against. Eggs look real healthy compared to donuts, but not compared to beans. That's what you compare. Do a study comparing eggs to beans, see what the outcome is. But they don't do those studies. They compare eggs to meat, so they can make eggs look good or not look so bad. Same thing with olive oil. The biggest scam ever perpetrated on the world's population is they actually convinced the whole population of the world to think olive oil is health food. Not health food. It's the seeds that are, it's the nuts, it's the walnuts that are the healthy fat, not the oil, not the refined oil. Here's some examples. Here's Martin. At age 66, he was 266 pounds and near death. He had heart failure, peripheral edema, cardiac arrhythmia. Right? He was atrial fibrillation, high blood pressure, on 11 different medications with a heart valve problem. He required urgent surgery. He weighed 266 pounds with a 51 H lane. He was near death. Now at age 70, he's lost 120 pounds. He weighs 146, no medications, normal heart rhythm, normal blood pressure, no edema, no breathing issues. He made a total recovery, no valve problems, no heart problems, no atrial fibrillation. He's well again. And you know what his business is now? He became a Mayo Clinic certified health counselor. He went into the health professions now. He's an example of great health. From near death and not only leaving the hospital alive, now he's an example of shining good health. It's what we see over and over again. Here's John Pelikowski. He's the guy on the right. He was supposed to laugh on that one. That picture was taken like 25 years ago. I don't look much different except my shirt's more baggy. But anyway, back in 1994, John had triple vessel disease, and his cardiologist told him he needed urgent angioplasty and stent placement. And I hadn't written books back then, but I convinced him in some way. I managed to convince him not to listen to his cardiologist. And I said to him, John, just give me 3 months, and you'll go back to your cardiologist after 3 months of doing this program. And I'll show you that the stress test can improve, and the cardiologist will see such an improvement in your condition that he won't want to do the surgery and put the stent in. Once you put that stent in, you can't take it out again. Amazing that I even convinced him to do it. And he went back to the cardiologist 3 months later, and the cardiologist gave him another stress test and said, I've never seen this before happen. I can't believe it happened. How much better you got in 3 months. You don't need a surgery anymore. Of course he never saw it happen before. He never advised people to change their diet appropriately. Cardiologists don't see what happens, don't have any knowledge about nutritional interventions. They're completely in the dark. In most cases, they're advising people to avoid nutritional interventions. It reminds me of just this last year, there was a doctor in Nashville, Darrell, a super nice guy, a physician, who had a heart attack in the hospital, and because he had 17 blockages in his heart, they wanted to do bypass surgery on him. So his sister-in-law, who's a doctor, had him call me on the phone, and I went over his case on the phone, and I said, you know, your heart, you have a lot of heart function, your ejection fraction is normal, you had a small heart attack. What you should do is not do bypass surgery. You should come to me and stay with me for a few months, drop 50 pounds, open up your heart, get back in good shape again, and you'll not have a damaged heart. You have a good... He came. I couldn't believe it. He did it. He came. And you know where he is today? Dead. No, just kidding. That was a joke. I just spoke to him like a week ago. He left my facility having lost about 35 pounds. He continued to lose weight, about 10 pounds a month, whereas he's gone home. He's lost 70 pounds. Man, it's been 5 months. He's dropped 70 pounds. He took a picture of himself like on a lounge chair in Tahiti or something. He's climbing mountains. He's having the time of his life. He's in great health. He's slim. He lost weight. Just like John here, John Pelikowski. And now what is that, 25 years later? He's 98 years old. I can't even get these people to die. He went back to his cardiologist, but what I'm showing you here with this case is that he didn't get older and see problems get worse. He got older and problems got better. His blood pressure continued to go down as he got older. It's the time you spend doing the right things. What I'm showing you right now, it's not aging that causes heart disease. It's the time you spend eating wrong. We're talking here about salt years and pack years. You know what I mean by pack years and salt years? You know what I'm talking about here? No? The pack years are how many packs you smoked for how many years, determine your risk of lung cancer. You know, you smoke 3 packs a day for 30 years, that's 90 pack year danger. The salt years are the same thing. You have a high salt diet of 3,000 milligrams of salt a day. That's 2,000 above the 1,000, which is acceptable. That's 2 salt years. You do that for 30 years, that's 60 salt years. You do 4,000 milligrams of sodium a day, that's 3 salt years times 20 years. That's 3 times 20, that's 60. You getting what I'm saying right now? Your risk of having a hemorrhagic stroke or damage is related to the extent that how bad or how wrong you do things and how many years you proceed to incur those bad habits continued over and over and over again. And the more years the sooner you stop, and the years that build up without those risks, eventually your body can reverse the damage slowly and gradually and get you back healthy again. If you smoke 2 packs a day for 30 years at 60 pack years, after 15 years of being off cigarettes completely, your risk of lung cancer almost goes down to a person who never smoked if you're 15 years out of those 60 pack years. If you have 60 salt years and you're off salt for 15 years, your risk of having a stroke goes down to almost a person who never had salt in their diet if you go enough years doing it right. When do you start that? After you have heart failure or now? When do you quit smoking? When you have lung cancer? But what does the American Cardiology say? The American College of Cardiology, American Heart Association say? They say, wait till you have heart disease and then cut down your salt to 1,500 milligrams a day. That's really bright. First of all, the studies show that when you go from 1,500 to 1,000, you still get extra benefits. And why wait till you have damage occur to cut it out anyway? That's the stupidest idea. And people are saying to me, I'm getting off on a tangent, they're always saying to me, why don't doctors know more about nutrition? And my response to them is, who cares if doctors know more about nutrition? The time you go to a doctor, it's too late anyway. You don't wait till you have something wrong with you and then fix your nutrition. You don't expect a doctor to tell you what to fix your nutrition. You should know what to do before you get to the doctor. It's not the doctor's role to do that. It's your role to do it, right? You should be learning this in elementary school, in grade school, in high school. You shouldn't be waiting for doctors to teach you. Here's Michael D. Marilek. Wow, Michael, he was really heavy. This is confusing. He was admitted in 2015 with heart failure, hypertrophic cardiomyopathy, with an ejection fraction of 20%. I mean, his heart was hardly even pumping out anything. He had an uncontrollable rapid heart rate. He showed a high troponin levels suggestive of a heart attack. He could hardly breathe. He had multiple codes in the hospital where he almost died. After a failed attempt to bring his heart under control, the doctors thought he couldn't leave the hospital alive. The nurses was crying. He was dying in the hospital. And incredibly, he got permission from the cardiovascular staff to allow to bring a nutritarian diet into the hospital to possibly save him. Incredible. Never seen that before. So the doctors who had failed attempt to save this guy looked at the acceptability of using my approach to possibly save his life. And what do you think happened? He died, right? No. I have stupid jokes. It's okay because laughing at stupid jokes also make you live longer. The joke doesn't have to be good. Just laugh anyway. It makes you live longer. So he obtained permission to follow this diet in the hospital. And his diabetes was brought under control. He came off his insulin in the hospital. After a few months, he left the hospital. He was no longer diabetic. His blood pressure came back to normal. Eventually, his diabetic retinopathy, his vision came back to normal. He didn't need eye surgery anymore. His blood pressure came back to normal. His ejection fraction came back to normal. His heart remodeled. He didn't have a cardiomyopathy anymore. His heart shrunk. And he became a normal guy. 3 years later, he's on no medication with no high blood pressure, no glaucoma, no high intraocular pressure, no diabetic retinopathy, and nothing's wrong with him anymore. I'm not saying wait till death. You don't have to wait to death to get this to happen, right? These people are almost waiting to death to change their diet, and it still works. Now keep in mind that there are 2 types of strokes. There's the embolic or ischemic stroke, which you know by now an embolism is caused by a clot. That's a clot traveling to the brain, blocking off a blood vessel, right? But there's another type of stroke. And the other type of stroke is called a hemorrhagic stroke. It's not caused by a clot. It's when a fragile blood vessel in the brain breaks open and bleeds. And those types of strokes are devastating and can kill you, or can put you in a nursing home for the rest of your life. That's the worst possible thing that can happen, is a hemorrhagic stroke. Now, which type of strokes are more prevalent in this country? The embolic stroke or the hemorrhagic strokes? The ischemic or embolic. And what type of strokes are more prevalent, let's say, in South Korea or Japan? The hemorrhagic stroke, because they eat much more salt, and their diet is more fish, more salted vegetables, and lower in bacon and cheeseburgers. And there you have lower cholesterol. Here's what I'm saying. It appears to be evident, and most likely, that the atherosclerotic process that thickens the blood vessel walls with fat and increase the risk of having an embolic stroke or a heart attack may offer some degree of protection against the high salt intake, causing hemorrhage or rupture of a fragile blood vessel in the brain. Because we also know that people with very low LDL cholesterols are at increased risk of having hemorrhagic stroke if they salt their food. Here's what I'm saying to you. I'm saying to you, on a plant-based diet, you dramatically remove your risk of an ischemic or embolic stroke, but you don't reduce your risk of a hemorrhagic stroke. You increase your risk of a hemorrhagic stroke if you're still on a high-salt diet. Did you get that? We don't want to just switch your stroke from a hemorrhagic stroke, from an embolic to a hemorrhagic stroke. We want to reduce all causes of strokes. And I see so many literatures in the scientific literature that's all written all wrong, because they talk about, food and stroke reduction and this and that, and they don't differentiate from ischemic from hemorrhagic, which are two completely different diseases with no relation to each other. You don't group together all strokes in one categories. They're completely different animals. They have different causes. But one thing we know is that salt intake doesn't just raise blood pressure, increasing risk of hemorrhagic strokes. Salt intake gradually over time weakens the endothelial lining, causes chronic inflammation, causes microvascular hemorrhaging and bleeding, gentle, slow bleeding into the brain tissue before the vessel ruptures and hemorrhages. In other words, a high salt diet, salt in your diet gradually weakens the interior lining of your blood vessels, reduces nitric oxide formation in the interior lining, over time increasing your risk of having a hemorrhage in your brain. You're making a big mistake if you're going to move your diet to a vegan or plant-based diet and still use salt liberally on your food. Big mistake. Diet and autoimmune disease. Let's move on. Because autoimmune disease is not predominantly genetic. There's some genetic instances, but the concordance studies on twins show that there's no consistent relationship between the genome and the risk of autoimmune disease, that environment and diet plays a major role over genetic influences. And there's a recent rise in autoimmune disease, an explosion in autoimmune disease that parallels the increase in cancer in this country from 1920 to 2020. Well, actually, the cancer rates went up from 1920 to 1990 the most. It kind of leveled off at 90 to go 2000 because doctors stopped prescribing estrogen for women, for postmenopausal women. In other words, the biggest thing to stop breast cancer in this country, to let it curtail down, wasn't doctors prescribing chemotherapy, it was doctors stopped prescribing estrogen. Did you follow that? But what I'm saying right now is that this increase in the processed food and fast food industry, which created an explosion of cancer, also created an explosion of autoimmune disease, and there's a strong parallel and relationship between eating fried foods and fast food and the development of autoimmune conditions as well. Salt leads to immune system dysfunction. Heating oils, leads to reactive oxygen species and rancidity that destroys and interferes with normal immune function. And a high glycemic diet, eating these processed carbohydrates, also creates Klebsiella and other bacteria that grow in the gut that also have negative dysfunction on T helper cells that can no longer control an excessive immune response, and you develop a leaky gut syndrome where antigens can pass through the digestive tract wall, and it takes years to reverse these things. And the animal protein and the high saturated fats also exacerbate that. So diet has a big role to play in the development of autoimmune diseases, and the protocol we use for people with autoimmune disease to help reverse it is we give people extra omega-3 fatty acids, EPA and DHA, and we usually give them omega-3 fatty acid with a higher EPA component than DHA because it has more immunosuppressive effects on the overexcited immune system, at least temporarily, to help get them off some of the medications. We also give them high-dose probiotics so they can help some of the leaky gut, and we do that temporarily in the transition phase. And we also give them triple vegetable juice. The reason we give them triple vegetable juice, I mentioned this yesterday, we do it with people with cancer. Because when we measure the phytochemicals and antioxidants that are needed for normalizing immune function, and you measure them in people like myself or other nutritarians who've been eating this way for years, we find the level of our biophytonic scanner is about 100,000 on our skin. On a person's on an American diet, the levels might be 15,000 or 20,000. And if we have them eat healthfully for a few months, it might get to 50,000 or 40,000. But it's not going to get them to 90 or 100,000 where they need to get to maximize immune function. By adding the juices, we can get them up to a higher level quicker. We can get them to have more vegetable substances in their bloodstream and more penetration into the tissues, because it's not good enough to get the antioxidants and phytochemicals in the bloodstream. You need them in the brain tissue, in the bone marrow, in the skin, in the liver. You need them penetrated into the tissues. And we give them this 1/3, 1/3, 1/3 juice, which has 1/3 dark green lettuces, 1/3 green cruciferous, like bok choy or cabbage, and 1/3 carrot and beet. And they drink this 9 ounces of vegetable juice a day to decrease the time it would take to get those nutrients into the tissues at high enough levels to be maximally effective. Are you following me now? And we sometimes have them not eat a few days a month. And we utilize intermittent fasting. We have them some nights skip dinner because when we reduce calories, we cool down the excessive immune response. Because with psoriasis, psoriatic arthritis, and lupus, we find that excess calories fuels the excess explosion, the excitatory effects of the immune system. I'll give you a perfect example. Kind of interesting case. One guy came into me with psoriasis that was very severe of his whole body, and I fed him a healthy diet for a while, and I put him on a 1-week fast, and he followed a pretty much raw food type diet after that, and he came back to me in a few months where he started to be a little malnourished. No psoriasis, of course, that was cleared up. But he was so malnourished, he was having some other issues, like a little rectal prolapse and other signs of deficiencies. So I had to give him a little more food, and as I gave him a little more food to get him healthier, his psoriasis started to come back. What I'm saying right now, he didn't do the diet long enough to really achieve the results we wanted to achieve, and he got well eventually. But in that interim phase, there was an art there of giving him the right amount of calories, but not too much or too little, because as we gave him too much calories, his psoriasis came back, and as we did too little calories, other things happened. So in other words, so the excess calories and the episodic, intermittent, and periodic fastings help people with Crohn's disease, ulcerative colitis, and lupus particularly, especially if they're not on these dangerous drugs. And the reason we're giving these juices and the probiotics and even the fish oils is to get them off the drugs faster, because the immunosuppressive drugs that rheumatologists use for autoimmune conditions are powerful cancer-causing drugs. So a person with psoriasis or lupus having to take Imuran or all these drugs that powerfully suppress the immune system are making a pact with the devil. They're using a drug to make them feel a little better at the expense of taking 10 or 20 years of their life down the road when they get cancer. And when they get cancer, you don't just die like flying your helicopter into a mountain. You're not just dead on the spot. You are dying slowly and painfully over many, many years when you go to these rheumatologists and take drugs, which wouldn't be so horrible was the only option, but it's not the only option. People can get well from autoimmune conditions with nutritional excellence, and that's what we're going to look at right now. We're going to look at some cases of people who get well with nutritional excellence. Can I go back? Yeah, I can go back over here. No alfalfa sprouts is what you were looking at, because alfalfa sprouts contain a substance called cannabinoid, which is excitatory for lupus and arthritis. We give people sprouts, yes, but not alfalfa sprouts. And we don't give people usually gluten either, because too many people are sensitive to it, but mostly with autoimmune conditions. Now, we studied some of the members at drfuhrman.com, which is a website that I am quite familiar with. And the people who had acne found that, about 90% of them showed their acne improved in a short period of time, and most of them got rid of it. about 70% had no more problem anymore. And, and these people weren't 100% compliant. They're just members of the website. With psoriasis, we had 33 people we had claimed they had psoriasis there, and 97% showed significant improvement, and 82% showed dramatic and complete improvement. It's incredible. These are not people under my care, not people who came to my office or stayed in my retreat. These are people just on the website following what we're doing. Irritable bowel syndrome, 93% improvement. Ulcerative colitis or Crohn's, 88%. Significant improvement, almost 60% dramatic improvement or resolution. Here's some cases. Here's Jody, who we saw about 15 years ago. What is the year on that? It says 2006. Yeah, about 15 years ago. She had psoriatic arthritis on steroids and other drugs for most of her life, in bed for 30 years, unable to move too well with her psoriatic arthritis. She made a complete recovery. I remember Jody came to one of our retreats, and we climbed a mountain together, and she went to the top of the mountain after not being physically active for most of her life, put her arms up in the air and said, "Look at me, I'm a medical miracle. I can climb mountains without psoriasis or arthritis now on no medications." You know, it's not a miracle, because it's not a medical miracle. The miracle is, and the message here, is that inherently your body is the miracle. You have a self-healing body, that these diseases are not natural. It's not natural to have psoriatic arthritis. It's natural to be healthy. It's not natural to get cancer, to get heart disease. You're taught, and you're trained, and you're brainwashed to think that these diseases, right? You're brainwashed to think that these diseases are genetic, the natural consequence of aging, and just bad luck, and there's nothing you can do about it except go to your doctor and let him take care of your health by giving you drugs. Isn't that what most people think? You've taken away all of your self-determination. You've taken away all of your ability to take control of your health and do the right thing. So there's Jody. Here's Chris Miller. Chris Miller is a medical doctor, was living in Aspen, Colorado, who developed lupus, put on steroids and other drugs, didn't get better, had to quit her job as a doctor, couldn't work in an emergency room anymore, too sick to work, too much risk of infection to be safe for other people to be in contact with her, pretty much had to quit work, and then, after these drugs failing her and feeling so bad and losing her hair, she came to one of my immersion programs, and she was shocked by what she heard, and she changed her diet, and what do you think happened? Her lupus went away. Right, she didn't die. Her lupus went away. She's back a physician again. She's back as a functioning doctor, working again. And you know what? She just ran a race. Now she's running, skiing, enjoying her life. She got her life back on no medications. Here's Kelly with autoimmune hepatitis. At age 50, she found out she had an ALT, a liver with greater than 500. She was told by her doctors that if she didn't take high-dose steroids and other immunosuppressive drugs like Imuran, she'd need a liver transplant or be dead. Yet she refused that, because she contacted me through the member center on the website and asked me if it's safe for her to try this for a while to see if she could stop not to take the steroids or the drugs. And I said to her, "I don't know for sure, but let's give it at least a few weeks and see what happens." Here's what happened. There's the data. After just 3 weeks, her levels started to improve. Isn't that amazing? Just 3 weeks after telling her she was going to die. You can see after April, May, or June, her levels dropped from 500 to about 250, right? They dropped in half. By September, they dropped to 100. Don't forget, normals are like below 50 or something, right? Within 1 year, her level was completely normal with no autoimmune hepatitis, made a complete recovery, and she never looked back and was never sick again a day in her life. Pretty amazing, huh? Now, what's similar to all these cases, in every case, the doctor involved with their case told them that if they didn't follow the doctor's advice and take the drugs, they would die, need transplantations, or do something radical, that this is radical and not going to work. They all were told diet didn't work. It reminds me of a case. I have to tell you a case with a bad outcome. There was a girl, a teenager. By the way, I have a teenage patient with lupus who was on the National Renal Transplant list with a creatinine of 4.2. You know what a creatinine of 4.2 means? That means you're waiting for a kidney transplant. She got her creatinine down to 0.8. She got completely well again and off the medications. Amazing, right? I wouldn't even think that would happen, but it does. So I have this person call me on the phone. Their daughter is hospitalized in a hospital in Boston. I think she was in Brigham Young Hospital in Boston. And she wanted to take the daughter out of the hospital to see me as a patient because the drugs were not working and she was continuing to deteriorate and her numbers were getting worse under conventional care. So what do you think happened? They put a policeman, the doctors involved with the case, got a court order and put a policeman in front of the room and wouldn't let the child leave the hospital or the parents control the child's care, and the doctors now had free rein to do what they want without the parents' intervention into the case. So the parents brought a lawsuit in Connecticut where they lived, and they had me travel to Connecticut to testify before the judge. It's a sad case, just to warn you in advance. And they had me testify before the judge some of my outcome with lupus patients using this approach and to show that this person was deteriorating and not getting better under conventional care. And when the judge saw the cases and reviewed my science, and he ruled in our favor to allow the child to leave the hospital and come to my clinic and see if we could help her. And I wasn't going to stop. Don't clap. The child died before she left the hospital. This was because there was such a delay of weeks and weeks of getting the child out of the hospital because the medical profession was able to keep the kid there against the parents' will. And you know what? In the hospital, they reported to me that there were multiple police officers on the floors keeping kids in the hospital against the parents' wishes because the doctors decided this was the care that was right for the children, and they weren't letting the children go out and do another type of care other than it was conventional care. You following that? You could see what just to give you an example of the type of, what I've been living with all these years. It's been a big fight. Here's April, who had severe multiple sclerosis by the age of 48. Her tongue got numb, and she lost control of her body and couldn't walk anymore. She slurred like a drunk. She couldn't control her bladder. She was diagnosed with multiple sclerosis, with lesions in her brain. And what do you think her doctors told her? They told her, if you don't take these drugs, you're going to deteriorate and be in a wheelchair the rest of life, and you're never going to get well. Did that happen? No. She was informed that diet had no impact on MS. With just 6 weeks of following this program, she got feeling back in her tongue, and she started to be able to feel and to talk normally again. The slurred speech went away. She was thrilled. That was just 6 weeks. Within 6 months, she was back to walking and feeling normal again. And now she's repaired herself, has no multiple sclerosis, no signs of it. It gradually went away. She's lean, strong, healthy, at her perfect weight. She lost 40 pounds, and she's back to enjoying a healthy life again, like so many others with multiple sclerosis. Here's Janet, who had multiple sclerosis too, had MS, lost 100 pounds. She was on steroids and other drugs, but she lost her 100 pounds, got rid of her MS, her migraines, no more high blood pressure, and back to living a normal life. And these people are so grateful, and they are the superheroes. Because think of what they had to do to achieve wellness, to go against the advice of their doctors, who always threatened them and told them this couldn't work and wouldn't work and was going to kill them, and diet doesn't work. They had to be courageous, right? But here's John, who lost 160 pounds. This is an interesting story. He's a truck driver who started dating Sarah, who was overweight with multiple sclerosis. But he was 160 pounds overweight. He weighed over 350 pounds, too. So he lost his weight, got healthy, and he started dating Sarah as he was losing weight, and he started telling her about my work because she had multiple sclerosis. And what do you think happened to Sarah? Oh, I went the wrong way. What do you think happened to her? She lost 100 pounds, got rid of her multiple sclerosis, and they got married. This is better than Bachelor in Paradise. Look at her now. Wow, amazing, huh? It's exciting to see these people get well. And type 2 diabetes, think of all the people around the world with this explosion in type 2 diabetes, the fourth leading cause of death, the leading cause of blindness, of limb amputation, and kidney failure, all caused by visceral fat impregnating around muscle tissue and other cells of the body that interfere with absorption of glucose. And then you have the buildup of the fat preventing insulin from working, so the beta cells in the pancreas have to produce more insulin to get the sugar out of the bloodstream. And the beta cells have to do more insulin and more insulin and more insulin. So they fail with producing more insulin because they get pooped out. And they start producing normal amounts of insulin. But the sugars are now too high because the body needs more than normal amount of insulin. So what do doctors do? They give you more insulin. They give you drugs like Amaryl and glucophage or glypiride, which push the failing beta cells to push more insulin out, or give you more insulin, which causes you to gain more weight, to become more insulin resistant, to make the failing beta cells fail faster. More medications, more medical care, more death. That's what happened in the ACCORD study. These medications cause weight gain. They cause you to become more diabetics. The ACCORD study was stopped in 2008 because when they did this controlled trial, the people who were put into the group with more medical care, more diabetic specialists following their case so they can medicate them more appropriately to keep their sugars better controlled, those people with more drugs and more care were dying, getting more morbidity and mortality and more death. So the NIH had to stop the study because they showed that people with less medical care, with more poor glucose control, with worse glucose levels, were living longer than the people with good glucose levels. Does that mean that having a good glucose level is not good? No. It means that drugs to get good glucose levels are no good. You have to do it with exercise and diet. You have to earn it. You can't drug yourself into good health. Eggs and diabetes. And eggs are particularly unique in the field of animal products because egg yolks contain more cholesterol than any other food. And we're taught that the cholesterol from eggs is no harm because your body makes cholesterol from saturated fat, not from cholesterol. And the little extra cholesterol from eggs doesn't matter very much. That's not true. The cholesterol from eggs matters a lot, and it takes a lot of work for the body to get the cholesterol out of the bloodstream. And even 7 or more eggs a week in men increases the risk of developing diabetes by 58%, and in women, 77% more likely to develop diabetes for regular egg eaters, especially with overweight people. And diabetics who eat eggs are twice as likely to die. What's this nonsense that eggs are... They convince you with all this nonsensical data where the studies are rigged. And when you have people that are fragile and metabolically challenged and sick, we don't want to give them a diet of high in white rice and white potato. It's not the ideal way to eat. We look at carbohydrates on a hierarchical scale of quality. Give people healthier carbohydrates if you have a choice. It's not true that a little bit of this or a little bit of that is still a little bit of extra stress you didn't need to have on a person whose body is breaking down and at risk. Why not optimize the nutrient levels? The studies show that when people switch from white rice or white flour and they move to whole grains, their risk of developing diabetes or reversing diabetes improves by 30%. But when people switch from white flour or white rice to beans, their risk goes down by 60%. It's much more effective to go to more beans and less grains even when you have diabetes. But certainly, whole grains are much more protective than white potato. We are putting carbohydrates on a hierarchical scale of quality based on the amount of fiber, the amount of resistant starch, the glycemic effect of that food, the nutrients in that food, and let's pick the best food possible when people are metabolically challenged and are at high risk of having some medical condition. Are you following what I'm saying? We have a limited amount of calories to choose from. If you're sick, why not make the diet the best it can be? You don't want to make it second best. You want to make it first best. Do you agree? Beans are the most favored carbohydrate source. And then we eat a lot of non-starchy vegetables, like eggplant and mushrooms and tomatoes and onions. And we eat a lot of green vegetables. and we eat the lower sugar fruits, and we eat nuts and seeds, and we overall lower the glycemic effect of the diet because these things do matter. They don't not matter. Everybody tells you nothing matters. Here's a study on diabetics which showed that 90% of them became non-diabetic within 6 months. Right? Their hemoglobin A1C mean came from 8.2 to 5.8, while the medications were being reduced and removed. Only one person in that study was left on glucophage. Everybody else was taking off all their medications. More greens, more beans, more nuts and seeds means less refined carbohydrates, but more high glycemic carbohydrate, which means less rice and less potato when you have more lower glycemic carbohydrates, and you improve the glycemic parameters of the diet and the metabolic parameters, and you encourage weight loss and encourage diabetes reversal. Here's Sandra. She had diabetes and migraines and palpitations and fatigue and sweating and high blood pressure and high cholesterol, and she lost a lot of weight. She went from 252 to 115. Look at her, 115. This is years that she's maintained this weight in great health. And how grateful she is. She's a great role model who's out there. Look at her, right? She has the superpowers. Because we don't need superpowers to fly through the air or super strength to bend steel with our bare hands, because we're not being invaded by aliens from another planet. We're being invaded by these diseases that are killing our neighbors left and right. How many of people here have their neighbors and family members that have been shot by a bullet or stabbed by a knife right in their chest or their neck? Raise your hand. What? Nobody? And how many of you have friends and neighbors that have a heart attack, strokes, or cancer? Raise your hand. Right? That's a neighborhood you got to get out of. You don't want to live in anymore. That's a dangerous neighborhood. What are you doing there? You're crazy if you're living in that neighborhood. Get out right now. Because Sandra, she's an example. She has the superpowers to be the role model to help change her neighborhood and save the world. And you've got the superpowers to be role models and be examples, because as you make your body disease-proof, you become the role model to affect your friends, your families, and your communities. You follow me? David Polk, he lost 155 pounds in 1 year, went from 330 to 175 in 1 year, resolving his diabetes. Wasn't too hard to get out of bed. He couldn't get out of bed. He was so depressed and anxious, and his diabetes was so bad. He weighed 330 pounds. Spent most of his days in bed with migraines, sleep apnea, on a sleep apnea machine with cramping in his leg, which he couldn't walk. He had skin boils and acne and skin tans and skin infections and brain fog. Whatever people have, they have all these diseases. They don't just have diabetes. They're really sick. His hemoglobin A1C was 11.4, and he didn't go on medication, right? Instead, he changed his diet. He lost his craving for unhealthy food. He says he liked eating green vegetables. He started craving them. He started enjoying this diet, and he watched his body transform with no diabetes, no depression, no skin rashes, no migraines. And the same thing happened to Tina. She lost 70 pounds and reversed her diabetes. Her hemoglobin A1C was also 11. She never was put on medication. She went to her doctor, and her doctor said, "You can't do this with diet. Your diabetes is too severe. Your hemoglobin A1C is 11. Your blood sugar is running 400. And she said, I want to try using Dr. Fuhrman's approach. And she brought him the book. And he said, OK, I'll just give you 6 weeks. Come back in 6 weeks. If your hemoglobin A1C is normal, I won't put you on medications. She came back in 6 weeks, and her hemoglobin A1C was 5.9. Listen, that's almost impossible. Let me explain why. The hemoglobin A1C measures a 3-month window of average hemoglobin. It was only 6 weeks. All the hemoglobin hasn't transferred over yet. She was still getting part of the hemoglobin levels when she had a hemoglobin of 11. The fact that it went normal in 6 weeks is an incredible. If it was 7.2 or 8.1, it would have been good enough from 11 to not need medication because it was going in the right direction. But she actually came in at 6 weeks with 5.9 because another couple of months later, her hemoglobin A1C, I think, was 5.2 or 5.3 even. It was really good. And she dropped, obviously, 70 pounds in 6 months, more than 10 pounds a month. Here's Howard. He's a doctor in my local hospital where I work in Flemington. He was an anesthesiologist who came to me because he had to quit medicine because he was feeling so sickly that undergoing surgery, He was feeling it wasn't safe because he was getting high and low blood sugars that was making him lose concentration while people are under the knife and he's controlling the anesthesia. You following me? He went from 100 units, when he started this program, he went from utilizing 100 units a day of insulin to utilizing about 25 to 26 units of insulin a day. 1/4 the amount of insulin, stopped his highs and lows, reduced his body fat. What I'm saying right now is type 1 diabetics have insulin resistance. They have some degree of type 2 diabetes mixed in with their type 1. And that's the part of it that kills them. Let me say that one more time. Type 1 diabetics are dying prematurely of heart attacks and leg amputations and strokes. And they're dying because they're overtreated with insulin, because they have insulin resistance, and the diabetologists are giving them as much insulin as they require to control their glucose instead of fixing their insulin at a more reasonable biological level and telling them to control their diet so they don't require excessive amounts of insulin. This enables a type 1 diabetic to live to be a normal lifespan. And Howard is now an example of a doctor in great physical shape with a ripped stomach, right, a six-pack, and good health, back in his careers with no highs or lows, using a fixed amount of insulin. He doesn't have to keep finger sticking and adjusting it every day. He knows he sticks with the same amount of insulin every day because his diet stays the same. And whether he exercises or doesn't exercise, he doesn't get highs and lows. He can work in surgery all day, helping people, and continue with his career. Here's Carol. She dropped 120 pounds from 350, 2012, saw my show on PBS, and now weighs 120 pounds. Can you imagine going from 350 to 120? These people didn't just lose weight. They got to their ideal weight. Are you following the difference? They didn't just lose weight. They reached their ideal weight, and they stopped losing. Like Vivian, who had acute pancreatitis with a ALT levels of her liver above 500, and almost died in the hospital with a lipid, I think it was 5,000 actually. Anyway, she was told she needed to be on insulin and statins and other drugs for the rest of her life, which she found that she didn't have to be. She got rid of her high triglycerides, got rid of her abnormal liver function, got rid of her diabetes in the process. A nutritarian diet is designed specifically with those foods to have dramatic anti-cancer effects. And when you have the anti-cancer foods, it facilitates the reversal of all the diseases we're talking about here today. Raw onions and scallions in the diet, cooked mushrooms every single day, raw cruciferous greens and cooked cruciferous greens too, cooked more moderately, some beans every day, some lower sugar fruits like berries, cherries, pomegranates, on a regular basis, citrus fruits, flax seeds, chia seeds. It gives you charge and it puts you in charge of your health destiny. Look at my friend Emily, who lost 100 pounds in 1 year. Look at her skin on her face and how much younger she looks 1 year later. Looks like her mother on the right. These are untouched photos. These people look younger, they feel younger, and they are younger. They're biologically younger. 2 minutes to go. I managed to finish in the right time frame. There's the kitchen and living room of my retreat, looking out the window at the beautiful park where all the coyotes and rattlesnakes are. Hiking and biking in the park. They don't bother people, but in any case, beautiful view of the palm trees and the ocean. It's just such a relaxing, serene area. And of course, I want to mention my new book, Eat for Life, which is not out yet. It's available for pre-order on Amazon. And I encourage you to buy it to get all this new information and the updates in the scientific literature. Because if you buy the book on a pre-order, just to let you know, it helps me an extra amount because the bookstores and the airport stores and all the stores that carry the books base the purchase of those books, how many they buy and how they position the store, based on the pre-orders on Amazon. And they get extra points, so the book gets better distribution across America if the pre-orders are higher. So it's beneficial to me for you to buy the book earlier rather than waiting till later to buy it. So if you buy it now while it's still on pre-order, you get it 3 weeks from now. And then we give you, by taking the fact that you ordered it and letting us know, we give you some beneficial materials at drfuhrman.com. We give you some extra benefits for pre-ordering it because it benefits me, obviously, for you to buy it now rather than a month from now. Eat for Life is my expected last book. Not writing more books after this. I need to take better care of my own health. Sleep more, relax more, and still work, but maybe not work through the day and night. You know what I mean? Thank you, everybody.